Good morning, we are the Group 2 and we would like to discuss about the health assessment, purpose, and its importance. According to Agency for Healthcare Research and Quality, health assessment is a set of questions answered by the patients to know about its personal behaviors, possible risk, life-changing events, health goals and priorities, and of course its overall health. In the health assessment, subjective and objective data collection are an integral part of this process. The purpose of health assessment is to help understand the information that is collected to develop a plan of care together with the healthcare team. It is used to evaluate the health status by performing various examinations to identify the specific needs of a person and how those needs are addressed by the healthcare system. Let's now proceed to the types of health assessment.
In a health assessment, nurses will ask sets of questions that the patient will answer. These sets of questions consist of personal behaviors, life-changing events, and overall health. In a health assessment, nurses will gather information, and with the information gathered, they will analyze it. Overall health will be determined in the health assessment. They will know if you have any illnesses or if you have any concerns, they will know what causes it. The nursing assessment includes gathering information concerning the patient's individual, physiological, psychological, sociological, and spiritual needs. It is the first step in the successful evaluation of a patient. Subjective and objective data collection are an integral part of this process. Under the health assessment, there is a physical examination. In physical examination, the nurses gathers information and assesses an individual's physiological needs.
So for the importance of health assessment, health assessment help nurses and patients develop a plan of care. Having our patient to actively engage in the process will help nurses and patients to work as a team to improve their health. Also, the data we gather during the assessment serves as the basis or used as a tool to communicate with other healthcare professionals involved in the care of the patient. One of the most notable importance of having a well-performed and documented health assessment is that it allows for a continuity of care. It helps all the professionals involved in the process to have access to the clinical information of the patient that allows them to incorporate or consider in their clinical judgment and decision making.
And one of the pillars or one of the important part of health assessment is physical assessment or physical examination. The same as health assessment, it is an organized, systematic process of collecting subjective and objective data. Now, physical assessment or physical examination are typically done by our primary care physicians or nurses. The importance of physical assessment is that this can give way to early interventions or preventions at any health issues we are currently have or possibly at risk for. So whenever we have a chance, get our vital signs checked by our physicians or nurses.
What is initial assessment? The initial assessment, also referred to as the primary survey, the foundation of effective nursing care. Improved patient outcomes may result from any strategy that enhances patient safety. In addition, to improve patient safety, the assessment will give complete information which is used by nurses to make a decision quickly and accurately.
Focus assessment. This is typically done when the patient has a condition that affects a particular body system or when they complain of a particular symptoms. When there is a little time and the patient is complaining for a serious symptoms, focus assessments are helpful. A nurse can concentrate on the body system causing the emergency rather than inspecting irrelevant areas. For the patient, this treatment has the potential to save their lives. Also, it gathers pertinent data regarding the patient's present state of health after a change or new symptoms appear.
The emergency assessment is carried out during emergency operations in order to separate patients who need immediate care to those who can wait safely. The first examination you need to perform when you meet your patients is the ABCs: airway, breathing, circulation, consciousness, and safety. You should do another evaluation as soon as you have the reason to believe that your patient's condition has become unstable or on the verge of becoming so. Emergency assessment are used to inform decisions, determine the best course of action in an emergency, and determine the value that care that can bring to the table.
Ongoing assessment consists of data collection that occurs after a comprehensive database is established. The purpose of this assessment is to detect if there are any problems in the client's health or the client's body. And that will also help to determine the changes in the baseline data of the client. This assessment is important because it is about making sure that the client's care plan still meets the patient's needs and addresses any changes to the patient's health condition.